Thank you very much for the kind invitation. And I'm going to talk about challenging Ramadan fasting in diabetics. And let me start with appreciation to all efforts done by DAR, and it's usually my pleasure being one of DAR team. Let me also appreciate all efforts done to produce AGA and ESD guidelines and consensus for Ramadan fasting in people living with diabetes. But fasting Ramadan in special circumstances and diabetes comorbidities is a major challenge and needs more research. To fast or not to fast, how to assess, how to minimize the risk if a certain group of patients fast Ramadan. Let me discuss a few of them. This is the impact of daytime hypoglycemia, and the percentage of patients who broke the fast due to hypoglycemia is just 31% of the patients who experienced hypoglycemia, while 65% of patients having hypoglycemia did not break the fast. Let me start with this case scenario. Two types of diabetes with pregnancy. Fasting of the pregnant diabetic, and Mrs. Mona is a 28 years old type 1 diabetic since 4 years. Now she's pregnant in her 3rd month and wish to fast next Ramadan. And another type of diabetes with pregnancy, Mrs. Noha, 36 years old, discovered to have gestational diabetes during the 5th month of pregnancy, and she wished to fast next Ramadan. Pregnancy with diabetes need optimal glycemic control, whether pre-existing diabetes or gestational diabetes, by individualized insulin therapy, bolus insulin, and basal insulin. And the target glucose levels, fasting plasma glucose less than 95%, 1 hour postprandial of less than 140 milligram, and 2 hours postprandial less than 120 milligram. The glycemic targets during pregnancy, according to American Association of Clinical Endocrinology and American Diabetes Association guidelines, the preprandial blood glucose to be less than 95 in patients with gestational diabetes and between 60 and 99 in patients with pre-existing type 1 or type 2 diabetes. And for postprandial blood glucose, 1 hour postprandial less than 140 and 2 hours postprandial less than 120. And the peak postprandial in pre-existing diabetes is between 100 and 129. These figures are very tight, and there is increased risk of hypoglycemia, and the hemoglobin A1C target should be 6% or less than 6%. Pregnancy may be associated with impaired counter-regulation system and hypoglycemia unawareness, failure in physiological protective mechanism, and 45 to 71% of type 1 diabetes women experienced severe hypoglycemia during pregnancy, and severe hypoglycemia can occur during pregnancy 3 to 5 times more frequently in the 1st trimester, and the effect of hypoglycemia on the fetus is controversial, and there is possible role in teratogenicity. Low levels of maternal glucose during pregnancy may cause fetus retardation and small for gestational age infants. Maternal hypoglycemia may also cause impaired fetal beta cell function. Another group of problems during pregnancy, placental insufficiency and hypoglycemia, DKA, which is fatal sometimes to the fetus. Very high incidence rate of severe hypoglycemia between 19% and 44% have been reported in some studies, and another study in 2008 on type 1 diabetic patients, and they found that 45% experienced episodes of hypoglycemia. The decreased blood glucose level in pregnant women may affect fetal outcomes. For example, it may cause fetal growth retardation, small for gestational age infants, and impaired fetal beta cell function. The hazardous effect of recurrent hypoglycemia on the adult brain is well known. However, no available data on long-term effects of recurrent hypoglycemia on fetal brain health. Therefore, we cannot guarantee the safety of maternal fasting during Ramadan or long-term fetal brain health. Merghani and et al. Found a higher rate of induction of labor, cesarean section, and admission to special care unit of the newborn in the fasted group compared with the control group. Diabetes or gestational diabetes during pregnancy increase the risk of unfavorable maternal and fetal outcomes. Therefore, women with diabetes who become pregnant are instructed strictly to avoid Ramadan fasting. Now, come to another type of patient. What about fasting for lactating ladies? And regarding breastfeeding, data suggests that women with diabetes may experience hypoglycemic events during lactation. So it is advised to eat before or during breastfeeding to avoid hypoglycemia. Achieving desired metabolic control in fasting lactating women during Ramadan is challenging. Let's come to another case scenario, diabetes in geriatric times. And the risk of hypoglycemia may lead to impaired cognition, and this is increased in the elderly, and older adults may have more neuroglycopenic manifestations of hypoglycemia like dizziness, weakness, delirium, confusion, compared with adrenergic manifestations like tremors and sweating. These symptoms may be missed or confused as a primary neurological disease, such as transient ischemic attack, leading to inappropriate management. Severe hypoglycemia accounts for 17% of all hospitalizations for type 2 diabetes in the elderly. Age per se should not be a barrier for safe fasting during Ramadan. Comorbidities, complications, type of anti-diabetic medication, and the presence of hypoglycemia or hypoglycemia unawareness will remain a main concern. The presence of cardiovascular disease and impaired renal function could compromise the safety of fasting in elderly with long-standing diabetes, making their glycemic control challenging. This is the case scenario with many complications and comorbidities. A 69-year-old female housewife, diabetic, since 7 years, on GPP4 inhibitor and metformin, and this combination therapy is favorable for elderly and also for Ramadan fasting. This patient is hypertensive on ACE inhibitor and amlodipine, and she's also on clopidogrel and aspirin combination for recurrent TIA, and the last attack of TIA was 9 months ago. Then this patient is on clopidogrel and aspirin, and the effect of clopidogrel and aspirin is not maintained efficiently during Ramadan fasting according to different trials. And for the presence of history of TIA, if this history is a recent history during the previous 3 to 6 months before Ramadan, then this patient should not fast. This patient has no evidence of other cardiovascular disease, and her hemoglobin A1C is 7.4. She has advanced retinopathy, and according to AGA, advanced retinopathy is a risk factor for Ramadan fasting. Blood pressure 150/90. Examination is unremarkable except for edema of the lower limbs. She's hypothyroid and TSH is 9. and she's receiving 100 microgram of eltroxin. She's on statin for dyslipidemia. She has evidence of macroalbuminuria, although her GFR is 61. Macroalbuminuria, again, may be a risk factor for Ramadan fasting. And can this lady fast or not fast? Advances in medical care and improved social condition, increased life expectancy, and the epidemic of diabetes will involve older individuals. And according to the IGF 9th Atlas, 1 in 5 people with diabetes is above 65 years old, with a total of 163 million people. Diabetes in old age is a risk factor for dementia, falls, hip fracture, CVD, amputation, and visual impairment, and elderly people with diabetes have an increased risk of depletion. Thus, fasting during Ramadan in this group may affect their postural balance and attention, which may increase the risk of falls or fall-related injuries. بسم الله الرحمن الرحيم. يريد الله بكم اليسر ولا يريد بكم العسر. بسم الله الرحمن الرحيم. ولا تقتلوا أنفسكم إن الله كان بكم رحيما. صدق الله العظيم. ESD did a study, Fed study in 2018, and the number of fasting days in Egyptian people with diabetes, 98% of Egyptian diabetics intend to fast. And those who completed the 30 days of Ramadan fasting were 79% of the sample size in this study. And this question was given to Egyptian diabetic patients in their global survey. Did you break the fast because of diabetes-related illnesses? And 79% of the patients said, no, we did not break the fast because of diabetes-related illness. And another question given during their global survey, did you have to break your fast during this Ramadan because of hypos? And the answer was no, I did not have to break the fast in 35% of those having hypoglycemia. This study was done by ASD, again, culturally based pre-Ramadan education, increase the benefit and reduce the hazard of Ramadan fasting for type 2 diabetes. This is a proof that pre-Ramadan fasting is important and crucial for those who intend to fast Ramadan. Study again published many times, and this is the DAR global survey, Ramadan fasting during COVID-19 pandemic and the impact of older age on fasting among adults with type 2 diabetes, and these are the results. Between 3 p.m. and Maghrib, almost 50% of patients experienced hypoglycemic attacks. This is the main timing for hypoglycemia, whether for those less than 65 years old or more than 65 years old. This is the pathophysiological cardiovascular consequences of hypoglycemia, many complications, including increased blood coagulation, increased inflammation, reduced endothelial action and endothelial dysfunction, rhythm abnormality, and hypoglycemia result in EG abnormality and risk of arrhythmia. And there is increased incidence of acute cardiovascular events during hypoglycemic attacks was shown in this important trial. For safe fasting in the elderly, a pre-Ramadan focused education on safe fasting and when to break the fasting in hypoglycemia and hyperglycemia or dehydration, and to improve the hypoglycemic awareness, to stress on home blood glucose monitoring, good hydration, especially in summer with longer fasting hours. For safe fasting, again, in the elderly, DPP-4 inhibitor should be used over sulfonylurea as a second medication after metformin. And when using sulfonylurea, glycoside MR and glimepiride should be used instead of glibenclamide, and meglitinide may be used instead of glypuride, and basal insulin analog may be used instead of NBH. الجمعية العربية لدراسة أمراض السكر والميتابوليزم الحقيقة حصلت على فتوى قمة السماحة من دار الإفتاء المصرية، فإن غلب على ظن المريض أنه إن صام حصلت له مشقة أو صام ثم حصلت له المشقة، سواء باشتداد وطأة المرض عليه أم احتاج إلى تناول الدواء أو غلبه الجوع أو العطش، وهو حال غالب مرض السكر، جاز له أن يفطر. قمة السماحة. شكرا لحضراتكم. This is the summary and recommendation. A pre-Ramadan assessment is vital for any patient with diabetes who intend to fast in order to evaluate the risk, educate the patient to self-manage their condition during Ramadan, produce a patient-specific treatment plan, and most people with type 2 diabetes can fast safely during Ramadan. With support of their healthcare professionals, a post-Ramadan follow-up consultation is recommended. Ramadan Kareem. Thank you very much.